Tuberculosis, a disease which has an increasing number of patients in Balochistan despite government's efforts to diagnose and put the patients on treatment across the province. According to the prevalence survey conducted in 2012, an estimated burden of TB in Balochistan is 261 per 1 lakh population, giving an absolute number of 38,000 patients annually. How the Provincial TB Control Program has been providing diagnostic and treatment facilities to the patients. We have interviewed the Provincial Coordinator, and this is how he has explained the TB situation in Balochistan.
Assalamu alaikum. I am Dr. Sherif Sani. I am Provincial Coordinator TB Control Program Balochistan. Since 2019, we have doubled our centers. So we started with only 91 centers where we were giving treatment and diagnostic facilities in Balochistan free of cost. Now we have 179 total centers in public and overall 202 centers in overall Balochistan, public and private. So treatment and diagnosis, all facilities are free of cost in Balochistan in all 202 centers in Balochistan. So the last survey that was conducted, it was conducted in 2012. According to that survey, estimated burden of TB in Balochistan is 261 per 1 lakh population. And if we convert it into absolute numbers, so the total number of diseased persons per year in Balochistan with TB are 38,000, which means that we are covering around 49% of the TB patients. We are diagnosing them and we are putting them on treatment. So the 51% of patients are still missing. Either they are getting their treatment from another province or they might be getting their treatment from the private sector. But we are trying to engage the private sector as well. We are also bringing some legislations according to which TB would be a notifiable disease in all over Balochistan. Wherever a TB patient is being treated, they will be bound to inform TB control program. The day we diagnose all 38,000 of the TB patients and then we put them on treatment, and when the incidence is decreasing, the prevalence is decreasing, we will go into the elimination phase and after that in eradication phase. But that is a very long, I do not see it in a very long sight, so not in next 10 years. So we are doing good. Since 2019, we have doubled the cases. In 2019, we have total 9,000 cases. Now we have 18,000 cases. So TB control program is progressing. So the main problem, the main challenge is that we have, our budget is very low. We need a lot of money, lot of funds to control TB in Balochistan. So according to last provincial strategic plan, for 3 years, Balochistan Provincial TB Control Program would be needed 7 billion rupees to control TB in Pakistan, in Balochistan, sorry. But we have only 6% of the available funding, but we are still doing good. We are making efforts. I'm thankful to our current government, Minister Akhter Saab and Secretary Mujibur Rahman Saab. They have invested into TB after half a decade. This is the very first time in last 5 years that government has invested in TB in the form of a PC1. The cases are there. There are 38,000 TB cases annually in Balochistan. So we have to find all 38,000 till we reach 38,000. I am optimistic. In 2026, we are expanding our diagnostic network. Right now, we have 45 PCR machines installed in all over Balochistan, in all districts, all DHQs, all THQs. Now we are gonna install 36 more Gene Expert machines. Gene Expert is a PCR machine comparatively higher in sensitivity than microscope. So microscopy. So I'm optimistic that in the next year we would maybe cross 22,000, 23,000. We will be closer to the total number of cases that are annually present here. Actually, the concept is that you have to understand that the cases are not increasing. Cases are already there. Program is enrolling more patients now. So the main issue of TB control program is missing TB cases. Now we have diagnosed 18,000 in 36,000. 18,000 are still out of our approach, and we don't know where are they, what are they doing, where are they getting treatment. Maybe they are living somewhere and they're further spreading the disease. A single TB patient, if not treated, transmits the disease to 10 new patients in a year. So we have to find those and we have to bring them as well into our treatment. Now they know that TB is free of TB's diagnosis, TB's treatment, everything is free of cost in entire Pakistan, not only in Balochistan.